We are joined by Dr. Eric Miller of Lima Memorial Health System and their Foot and Ankle Center. Thanks for joining us this morning. And let's talk a little bit about total ankle replacements. Can you start by sharing maybe a little bit about what might be a cause for someone to need a total ankle replacement?
Usually these are people who have had an old ankle injury within the last 5 years or longer where it has healed in a bad position or it's affected the cartilage to the ankle joint. Second, usually there are people that have an ankle that's unstable where they constantly twist or injure the ankle repetitively over and over, where again it enters and injures the cartilage to that area. The third thing is there are some people that have a systemic condition such as rheumatoid arthritis or something along those lines where it does have a high affinity to affect joints of their body, including the ankle joint, where again that cartilage becomes affected. Those are the three most common type of things that we see for people that are candidates for total ankle replacement.
Okay, so what does this surgery look like and what advances have been made over the years?
Sure, I'm just going to show on the model here. So on this model here, this bone model, it's usually an incision centered over the front of the ankle and then into some of the middle of the foot itself. We get down to where the cartilage is and we resect the bony areas of this ankle joint here. There's a piece of metal that's placed into this, what's called your tibia, and then into what's called your talus. In between, then we use what's called a polyethylene spacer that functions as the joint and allows the ankle to move up and down here.
Okay, so what is the typical recovery time for someone that's had a total ankle replacement?
Usually with it, it's a total of 14 weeks of complete recovery till they're back to activities within normal. The first 4 weeks, they're not in a cast, they're in what's called a splint, and allows them to move the ankle up and down so the joint doesn't become stiff, and allows the metal components to integrate into the bone. After about 4 to 6 weeks, they're in a protective walking boot where we're gradually stressing the ankle replacement site. After probably a total of from the time of surgery of 9 weeks or so, then they're in aggressive physical therapy to help with strengthening and the range of motion of their ankle.
I'm going to assume that most people that have this total ankle replacement surgery are older, not necessarily younger people?
Traditionally, it used to be people of a certain age group that were older. Now most recently, it's had a movement towards people that are younger in nature with it. The biggest advancement has been what's called the polyethylene spacer. It's being made out of vitamin E, and this is shown to last a lot longer. Before in the past, the spacer would only last about 10 years, and people would have to have a revisional surgery where the spacer would have to be replaced. Now companies are coming out with spacers where they're lasting 25 years or greater.
Oh, wow. So if someone is watching and they would like to make an appointment with your office, how can they go about contacting you?
Sure, there's the number at the bottom of the screen. It's 419-998-8278.
Dr. Eric Miller, we thank you so very much for your very informational discussion this morning about total ankle replacements. And we'll be back with more right after this.